President of the European Commission, Ursula von der Leyen. We're also very honoured that you should be with us today. I think you've had probably more direct experience than most of the difficulties inherent in trying to coordinate responses, since your first task was to try to get European countries on the same page when it came to things like vaccine procurement. How difficult was it?
Well, this whole endeavor started when the United States announced this, you might remember it, Operation Warp Speed. And all of a sudden there was a rush to get, as a country or as a nation, at first access to potential vaccines. And it was very difficult at the beginning, but then we convinced member states that it's way better if we act together as 27 in the European Union. We have a better negotiation position towards the pharmaceutical industry. We're way better leverage. The pre-financing is easier. And it was the logic, which also is a global logic, that no one is safe until everybody is safe. You know that sentence. But this also means if we have a vaccine, we should have a common approach to give a fair share to everyone, so that the most vulnerable groups, the frontline workers and the healthcare workers, for example, are the ones who get the vaccine first. And this worked well. So by now, we have contracted with pharmaceutical companies so-called advanced purchase agreements. And what is hidden behind it? The Commission closes a contract with the pharmaceutical industry to have options on vaccine doses if this company finds the vaccine or has developed the vaccine. But what we're doing is investing now in these companies so that their production capabilities are increased. Then, if they are successful with the vaccine, the member states have access to buy their fair share of vaccine doses. The good part is, as we invest in increasing the production capabilities of the pharmaceutical industry, the production is not only for the European Union, but also for the rest of the world. And this we have to do now, because as the vaccines will be developed, of course, the demand for the vaccines will be high in large numbers, huge numbers, and for that you need the production capabilities. So we did two things: care, of course, for the European citizens, but at the same time also for the rest of the world. That is, for example, low and middle income countries who also need access and therefore the capabilities to really have these doses.
Madam President, you really illustrate there, I think, how important or what strength there is in numbers, you know, in a coordinated response. Tell us why you think that this equitable and global access to vaccines should be such a global priority for everyone.
First of all, it is a very clear point. Too many lives have been lost already. So that's point number one. And we know that there are groups that are more vulnerable than others. The second point is an economic one. We are so interconnected economically that none of us will get back to the former economic prosperity if the rest of the world is not doing better too. So that vaccination and immunization of the global population is increasing. And we had the example already because in Europe, for example, in the first wave, we had a huge impact of the virus in Southern and Western Europe, but the Eastern and Central European member states were not affected that much. But the economic impact that they had was as strong as in the other member states, even if the virus spread was not that heavy, because, of course, the value chains were interrupted, the flow of goods didn't function anymore, the export or import of goods was not possible anymore. So in a nutshell, this is an example for the whole world. We all know that if there are severe lockdowns and the spread of the virus is heavy in some parts of the world, the rest of the world, of course, as we have a globalized economy, is affected too. So there are good reasons to work together. And the last and most important reason is solidarity. So only if we work together, only if we join forces, we will be able to overcome this virus.
Madam President, I'm going to come back to you in a moment, if I may, about the prominent role that the Commission's decided to play in ACT in this effort to get vaccines to the world in an equitable and global fashion. I'd like to turn